Hello, and welcome to today's presentation of prior authorization requirements. The purpose of this training is an overview of the access prior authorization requirements. So, what is prior authorization? Prior authorization, or PA, is a process in which a health plan determines in advance whether a service, one that requires prior approval, will be covered based on the additional information received. PA may be granted provisionally as a temporary authorization pending the receipt of required documentation to substantiate compliance with access criteria. Granting prior authorization does not guarantee payment. Reimbursement is based on the accuracy of the information received with the original PA, on whether or not service is substantiated through concurrent and/or medical review, and on whether the claim meets claim submission requirements. In addition, the claim must meet all access criteria, including but not limited to clean claim and timely filing requirements. The service must also be rendered by an access registered provider. Any referring, ordering, prescribing, or attending provider must be an access registered provider. To find up-to-date access prior authorization requirements for the Division of Fee-for-Service Management, or DFSM, please see the outline below. There's the Access Medical Policy Manual, or AMPM, Chapter 820, entitled Fee-for-Service Prior Authorization, Fee-for-Service Prior Authorization webpage, and we have included the URL to that webpage down below, as well as the Fee-for-Service Provider Billing Manual, Chapter 8, entitled Prior Authorizations. The following services are not handled by DFSM, and you must contact the appropriate entity for authorization. For non-acute services for Tribal All-Text program members, please contact the Tribal Case Manager. For transplant services, please contact the Medical Management in the Access Division of Healthcare Management. For prescription medication, please contact the Contracted Pharmacy Benefit Manager, Optimum RX, at 855-577-6310. And for behavioral health PA requirements for acute fee-for-service members assigned to the Regional Behavioral Health Authority, or REBA, please contact the REBA. PA is issued for access covered services within certain limitations based on the following: the member's access eligibility, provider status as an access registered fee-for-service provider, the service requested is an access covered service requiring PA, and information received from the provider meets the requirements for issuing a PA number, and the service requested is not covered by another primary payer, for example, commercial insurance, Medicare, or another agency. Services that require prior authorization include behavioral health residential facilities, and for more information on behavioral health residential facility documentation requirements, please see the AMPM Chapter 320 entitled Guidance. Non-emergency acute inpatient admissions, Level 1 behavioral health inpatient facility and residential treatment center admissions, elective scheduled hospitalizations, and elective surgeries. So continuing on, services that require prior authorization include medical equipment greater than $300, medical supplies which are consumable that are greater than $100, and this includes all rentals and repairs, home health, hospice, skilled nursing facilities, and non-emergency transportation greater than 100 miles. For urgent requests, please see the Access PA Submission Process webpage at the URL down below. And use of the Access Online Provider Portal is the preferred method of submitting prior authorization requests for fee-for-service members. Online submission allows PA staff to process authorization requests efficiently and quickly. Providers may directly enter their authorization requests through the Access Online Provider Portal to receive a pending authorization number or case number. They may also use the attachment feature to upload supporting documents directly with their request. This has concluded our presentation on PA requirements. Should you have additional questions, please feel free to outreach to the DFSM Provider Training Team at providertrainingffs@easyaccess.gov. Thank you so much for joining me today. Bye-bye.